Pancreatic surgery has come a long way since the early days. So in today's world, you can have pancreatic surgery done by standard open approach or by minimal access approach. Minimal access will either be laparoscopic, which is conventional keyhole, or it will be robotic surgery, which is fairly new technology. And in terms of the operations that can be done for the pancreas, that will really depend on the disease we're treating, and will also depend on where the problem lies in the pancreas. So patients can have the entire pancreas removed, or they can have parts of the pancreas removed. Now, the head of the pancreas or the tail pancreas typically, and these will be the most common operations we perform on the pancreas. The very high-risk procedures, and without question, probably the highest risk surgeries we perform in abdominal surgery as a whole. So with the pancreatic resections, the main risks are the risk of leak of pancreas juice from where you cut the pancreas, the risk of the multi-organ problems after surgery, so they may need to spend a long time in the critical care unit. And also there's a risk of bleeding, infection, the risk of blood clots, as well as the possibility that these procedures may not be successful because the cancers, which is typically why we operate on the pancreas, the cancers may not be operable when we assess them at surgery. The recovery time is variable, and it depends on if you have the head of the pancreas, tail of the pancreas removed. Now, an operation to remove the head of the pancreas typically tends to have a longer recovery time. And if it's a straightforward procedure and it's done by open surgery, ballpark figure, people will be in hospital for about a week to 10 days, but you may need up to 3 to 6 months to fully recover at home. But if these procedures are done by minimal access, discharge from hospital is quicker and recovery time is quicker. If you do the same comparison with procedures for the tail of pancreas, and time to recovery are typically shorter. The best thing for any patient who's awaiting a procedure on the pancreas is that they have good nutrition, so eat well. If you've been provided supplements to help digest your food, and these are typically enzyme supplement tablets, take them religiously. If you have diabetes, make sure the diabetes control is perfect. And also, if you have any activity you undertake to stay fit, keep doing it. So with pancreatic cancer, which is the main reason why most patients will have pancreatic operations, the prognosis is not good. The risk of recurrence is very high. So we know the 5-year survival rate for patients is less than 20%. Now, this figure is better nowadays because the chemotherapy we offer patients before and sometimes, the chemotherapy we offer patients after surgery and sometimes before surgery has led to improvement in survival after surgery. So we still have the issue that there's a high chance of recurrence. So we advocate having chemotherapy after surgery. But as a cancer, it has a poor prognosis due to the high chance of recurrence. So for pain management, most patients will opt to have an epidural, which is a small tube that is placed in the region of the spine and provides regular pain relief. So patients have no pain in the abdominal area where the surgery has been performed. The epidural stays in for a few days after surgery, and when it is removed, most patients will be put on strong painkillers, which are typically based on opioids.